Okay, this video is for all you healthcare professionals out there who believe that they have something important to share with America and in the process want to get their names in print or maybe even their faces on TV. You've got a great idea and a very important story, but don't know how to get your story out there to America. I recently interviewed Phoenix New Times reporter Nikki D'Andrea to get some tips to help get your story out there in the public eye. Here's what I learned. Number one, ask yourself these two questions about your story idea. A, does it have a lot of impact? Are many people affected by it, especially locally? And B, is it old news? Has the topic already been covered extensively in the media? Or do you have something new, maybe some new information, new statistics, new evidence to say about an old topic? Learn to use the press release and to use the press release in an effective way. Write in a clear, direct, and very simple manner. Write in a way that any reader can understand. Do not use professional jargon, acronyms, or any terms that the reporter must look up. They're very busy already, and if they have to stop to look something up, as Nikki said, they will probably ignore your story. B, start the press release by explaining what makes your idea so newsworthy. The number of people affected, the seriousness of the effect, if there is any important pending legislation related to your topic, etc. Get your facts straight and convey them clearly. C, do your homework. Search for a reporter who might have covered similar stories already and mail or email these reporters directly. Follow up with a phone call. An email, too, wouldn't hurt matters. Don't become annoying, but please be assertive about wanting to get your story out there and the importance of your story. Get your name added to the reporter's Rolodex of expert contacts. This is easier to do than it might sound. A simple conversation with a reporter featuring your credentials and your general experience with the field that you work in will almost definitely get you into their Rolodex. And here's another thing. 3, if you want to bypass the reporter and write your own article or maybe even a column, a series of articles, A, contact the editor directly. Pitch your credentials. Show them why you're an expert in the topic and why you're in the best position to write an article about the topic. And B, include brief clips of your writing about your proposed topics, about previous topics to show that you're a competent writer, basically. There are an enormous number of important and interesting healthcare topics out there, most of which have never been covered by the media. Chances are that you're an expert on at least one of these topics. America wants and needs to hear what you have to say. You could change or even save lives. Following the few simple tips recommended by ace reporter Nikki D'Andrea could most definitely get your name and your topics out there both in print and in the televised media. Who knows? You could be the next Dr. Oz.